I'm Dr. Jacqueline Grant, one of the providers here for the Centering program, and I can't say enough about the program. I practiced OBGYN for probably more than 20 years, and I've done OB care the traditional way, and now I'm doing it the Centering way. And hands down, I just love the Centering approach. We actually spend so much more time with the patients that we know them better and we can take care of them better. And again, it's just a wonderful program, and I think most of our mothers that you'll hear from today will just go on about the experience that they had during their pregnancy, which is a once-in-a-lifetime experience.
My name is Nancy Rump. I am the administrative assistant to Dr. Grant. When we first began the centering, I had no idea that I would play such a huge role in centering. And once we did start, and once I found myself involved, I just love centering. To be able to see the moms and even the significant others come in and learn about what their delivery is going to be, what their health care needs to be during their pregnancy. When I see them bond with others that are in the same stages that they are, it's just amazing. I love it. I wish so badly that centering was around when I was a young mom. And I'm not a young mom now, but I learn things every time we have a session, and I have sat in lots of sessions. So I think it's a great program, and I hope to see it be able to continue.
Hi, my name is Karen Baker. I'm one of the family nurse practitioners here at Dougherty County Health Department, and I help to provide the prenatal care that the young ladies who are attending this program receive. One of the things that I like about the Centering program is that it brings together a oneness. Prenatal care is a journey, and it's a journey from the conception to the delivery of the baby. The wonderful thing about Centering is you get a group of women together who do about the same time. Not only do they learn about how to care for themselves, care for their babies, but they also get a certain oneness or closeness with one another. And that's a beautiful thing to watch, because even beyond the Centering program, they grow and they learn. Another good thing about the Centering is that we have the opportunity to teach. You know, as healthcare providers, we do a lot of teaching, and we actually watch these women put what we teach them into practice, and that's a wonderful thing. And it's such occasions as this reunion that we stand and we become so proud of watching our young mothers and how they interact with their babies, and how when they come back together for a reunion, how happy they are and how happy we are for them. So I enjoy the Centering program because it is such a positive thing in the Dougherty County community in terms of prenatal care, and it is very, very unique.
My name is Vermella Lovett. I'm the director of the Dougherty County Health Department, and the Centering program is a very valuable program here in the Dougherty County area. It enables mothers to actually come and interact with other mothers during their pregnancy, and this they learn together as a group, and I think that's very important, especially when you have young mothers. Instead of having all the different mothers go to a separate room and see a doctor or something, they do a lot of group activities, and they actually learn a lot of things about, they have classes about different things that's going on with them at the same time, and this just enables them to learn better, and it's just a wonderful environment where you can actually encourage mothers to take part in their care, and this just promotes just a better pregnancy experience.
Hi, my name is Danita, and this is Taylor Wilder. I am a mother of 3. My first child, Desireen, was born at 17. My second one, she's 5 years old. Her name is Anita. And he's the last one. If I had a chance to do all my births all over again, especially being 17 with my first one, I would have done the Centering program automatically for all 3 of them. Being in a group was the most wonderful experience because I did not feel that I was alone. They were all going through the same thing I was going through, all at the same time. They're real doctors, real nurses, and they're very, very experienced. I would recommend this program for anyone of any age that is pregnant.
Hi, my name is Marissa Jones. This is my son, my first and only son, Kaiser Lockett Jr. I feel like this is a great program. It's an exceptional program as far as this being my first child. They taught me everything that I would probably go through, and so I get it in my state of mind frame as to what would happen in my birth. I just feel like this is an exceptional program.
I really enjoyed my centering experience. It was a great program. I'm in love with the health department anyway, so I felt more comfortable being in a group, being with people that I used to being around, Dr. Grant, Miss Monique, and everybody, and I just loved it. I was taken very good care of, so I loved it.
Hi, I am Latia Carter. I was a part of the first centering program group, and it was the best experience I ever had in my life. I tell everybody about it. If I ever decide to have any more kids, I'm coming back every time. But it was everybody, the relationships are still strong, and it's the best thing ever happened to me. I'm glad I made that decision.
My name is Tabitha Mathis, and I'm excited about the centering program because it helped me face a lot of challenges I was going through. We had a lot of support from the doctors and our nurses. I learned a lot about breastfeeding, the labor pains, labor and delivery pain. This is an example of a breastfed baby. He latched on very good. At the hospital, they waited a while to try to feed him, but he was hungry right then, so I gave him my breast, and he latched on very well. I also learned a little bit about when to go to the hospital, what's the right time to go to the hospital through the centering program. Usually I have 5 kids. With the other 4 children, I just went to the hospital immediately. I didn't wait my time, wait 3 to 5 minutes to go or whatever. But this time I waited the exact time or whatever, and I was more calmer. I wasn't doing a lot of screaming. Basically, it's a good program to go with.
Hi, my name is Sade Hamilton, and this is my son, Javion Yarbrough. I'm a mom of 3 also. I've had multiple different experiences with childbirth because I'm not actually from Albany, Georgia, but I can say the centering program made me confident, and I wasn't scared of none of the information that they were giving me. Because I know by being your first pregnancy, you'll be scared. Everybody has different tales to tell you about everything, but they just basically just kept everything real. They didn't sugarcoat anything, and they let us know everything we needed to know. And this was actually my 3rd child, but I found out way more information by going to the centering program than I did with my other 2 children. And I was comfortable. I wasn't scared to ask any questions about anything because they just made everything, you know, it felt like family, really it did. So I would suggest you to go to the centering program. It's real nice to have someone to have your back, to, you know, just help you out every once in a while.
Oh, centering program is a great program. I'm currently 35 weeks pregnant, and this is my last child.
Hello, my name is Angie Williams, and this is my first time in the centering program, and I am a little bit older than a lot of people here, so being in this program really helped me to see that when I had my first child, if I would have had this, it was very important. But I'm just glad that Dougherty County decided, and a lot of other counties are deciding to pick up this program because it's very important for those younger people, I won't say children, but younger people who are now deciding to have babies. It's definitely a learning experience for them and their parents and their significant others as well. So I just hope that the centering program continues, not only in Dougherty County, but the rest of the rural areas decide to pick this program up and use it to the best of their ability.
My name is Michelle Rivers. This is my daughter Chantrell Rivers, and then my grandbaby Kamaya Green. The centering program has been a good benefit for us. Myself having children at an earlier age, centering was not available for us, and just being part of it, watching my daughter go through it, has been very helpful. I think it helped make her first pregnancy and experience a good one.
Hello, my name is Amby McManus, and this is my son, Marcel McManus Jr. And I just want to say that centering has taught me a great deal. Those at centering, they help educate me concerning my pregnancy, letting me know what was going on inside my body, the different appointments that we had. The group experience was a wonderful experience because those who were in the groups, you know, they helped us to be able to relate to each other. And as far as they also taught us, you know, what would go on in the delivery room, and it kind of helped calm my nerves, you know, regarding, you know, what would go on in the delivery room, because being a new mom, I didn't know really what to expect inside of the delivery room, but they taught us, you know, and let us know that everything would be okay, just the necessary precautions that we needed to take, you know, while we were pregnant. And I just think centering was a great experience for myself, and I would recommend it for any young woman who's pregnant and who's needing guidance and who doesn't really know what to do while they're pregnant. I would direct them to the centering program because it is a wonderful and great experience, and I just want to thank all of those at Centering for doing such a great job to educate all of us young women.
Hello, I am Portia Smith. This is Zion Ward. She's 1 year old. She was born August 8th. My experience here at the Centering program really taught me a lot. It taught me how to be more comfortable and familiar with having a baby and the birthing procedures of having a baby. Dr. Grant also taught me how to, well, the staffs and Dr. Grant also taught me how to count with like the terms that the doctors would say when you're having a baby, and you know, the different things that they might say, so you'll be alarmed and won't be scared or shocked. So it's like, I would tell anybody that's a new parent or a new mom to come to the health department and join the Centering program, because not a lot of people know about this program. But it is a great program versus going to a regular doctor. You can come in, you get seen right when you come. You don't have to wait. You meet other different females, so you're going through it with somebody else. You're not going through it alone, and you're able to talk to other women about the same problems that you're going through. So it's a great program. Again, I say come to the Centering program at the Albany Health Department.